Good afternoon. Thank you all for being here, and for those in the press that are on the call, thank you very much for being here as well. We're coming to you today to continue to raise the alarm about the deadly threat of COVID-19. Our hospital system is stretched to the point of pain, and I want to talk you through the data that we are following very, very, very closely. I've pored over the data the last 2 days, looking first at the 2-week numbers from June 30th through July 13th, then also looking at the spreadsheet which has the 7-day numbers between the 13th and the 20th. You've heard me talk about data and that every decision that we've made throughout this process has been data-driven. You've also heard me say that when we are talking about the counties that have mask mandates, 23 of them total in Mississippi now, we look at counties that have over 200 cases over a 14-day period, and or those counties that have more than 500 new cases per 100,000 residents. That's the reason you see a wide range of counties throughout our state, but virtually all of the largest counties fit into one of those two categories. However, the White House, as we've had many conversations with them over the last couple of weeks, Dr. Birx and her team look at those counties with more than 100 cases over a 7-day period and have a testing positivity rate of greater than 10%. Now, remember, just to put this in perspective for everyone that is watching today, we would put you under a mask mandate if you had over 200 cases between June 30 and July 13th. In fact, we did. Hinds County had 873 cases over those 2 weeks. DeSoto County had 698 cases over those 2 weeks. Harrison County, 436. Jackson, 407. Rankin, 355. So each of those 5 counties were almost or above twice what the limit would have been for us to put them on alert and a mask mandate. If you start looking at those counties that have had more than 100 new cases over a 7-day period, and keep in mind, this is incomplete data because every single day we get new cases in. But just to give you an example, over a 1-week period, we have 393 confirmed cases in Hinds County alone. Over a 7-day period, almost 200 confirmed cases in my home county of Rankin. Coahoma County, 149 cases over 7 days. I can remember at the height, or what we thought was the height of COVID-19, certainly at the height of COVID-19 in New York back in mid-April, when we had 1,500 cases in a week, we thought it was bad. My friends, we're going to report, when Dr. Dobbs gives you the exact numbers here shortly, over 1,500 cases today. That's after having over 1,500 cases yesterday. What does that mean? The spread of the virus is bad. But some of you would argue, well, it's really not that bad on young people, and it's okay if it spreads amongst young people. What Dr. Dobbs has repeatedly told you, however, and it's true, is that so far over the last 5 months, approximately 17% of those who get the virus and are reported as positive end up in the hospital. So what does this large number of increased cases mean to our hospital system? We've had 4,064,364 cases in America. Of those, as of today, only 1,898,960 are being reported as having become well. That's because we've had such a huge number of new cases, not only in Mississippi, but across the country for the last 4 weeks. When I look at total hospitalizations in our state, this is what we see. We've gone from approximately 490 patients in hospital beds across Mississippi to approximately 1,000. In fact, on July 1, remember on June 27th we had 490. On July 1 we had 602 confirmed patients in hospital beds with COVID. Today we're reporting 942. That is a 55% increase in patients in the month of July. We've added over 340 patients in less than 3 weeks, in less than 20 days. Now, I understand these numbers are not as big as what you see in Florida. And I understand that these numbers are not as big as what you see in Texas or California. But the absolute number is not what's important. Remember what our goal was. Our goal was to work together as a people so that we ensured that every single Mississippian that could get quality care got it. That's been our goal since the beginning of March. We've never believed that we can completely eradicate this virus. We never believed that we can stop the spread of it. But we know that if we do the little things, we can slow the spread of it. Make no mistake, if I could simply sit here before you today and sign on the dotted line a new executive order, which automatically would slow the growth, I'd do it in a heartbeat. But it's not about the words on the page, it's about how are you acting? How am I acting? How are we all acting? And let us all confess, up until this point, we've all made mistakes. The experts have made mistakes, the docs have made mistakes, the politicians have made mistakes, and the people back home have made mistakes. But we cannot change the past. We can affect the future. Back to the number of cases and the number of hospital beds that we have available. What's important is not the absolute number of new cases. What's important is not necessarily the total number of ICU beds we have. What's important is how many cases we have relative to hospital capacity. Let's look at the data. There are a total of 272 ICU beds in the West Central region. That's basically Jackson and a few other hospitals. 272 available if none are full. Today, we have 2 ICU beds available in the entire region. Today would be a really bad day to have a car wreck in Jackson. It'd be a bad day to have an accident. It'd be a really bad day if you're in central Mississippi for something to go wrong. And oh, by the way, it's a really bad day to have COVID and need to go into the hospital. I wish that West Central region was the only region where there was a problem. It's not. Keep in mind that every ICU bed that is available is not created equal. There are facilities throughout our state that have open ICU beds, but the level of treatment are not going to be the same in those hospitals than in our level 1 facilities. Not that it's bad, it's just different. We have a trauma care system in place in Mississippi, one of the first in the nation. often looked at as one of the best in the nation, but it's predicated upon the ability to take a patient in a rural part of our state that needs a higher level of care and transferring that patient to one of our level 1 facilities, to UMMC, for instance. My friends, currently, our diversions of C-Care that cannot accept ICU patients are approximately 20 hospitals throughout our state. Our hospital system is stressed. Dr. Dobbs and I did a call earlier today in which we talked to our hospital administrators. We had a very good, open dialogue. We agree on a lot of things, but not everything. But this is what I said to them. I said, if you can surge ICU beds, now is the time to surge. I also said that if you are deferring COVID-19 patients, we are going to look at eliminating elective surgeries on a facility-by-facility basis. Not because we want to, not because we think that means every patient in the state will get the best quality care, but because it's going to be necessary. It is critical that on the hospital side, that our friends in the industry surge if they can surge, but also work with us to decompress the system. But what I want you as my fellow Mississippians to know is that's just one part of the equation. That's dealing with what we know is the rising number of cases and therefore the rising number of hospitalizations. They're going to do their part. I am confident. The question that remains to everyone out there is, are all of us going to do our part? You know, the president spoke yesterday. The president said that he believes that it's patriotic to wear a mask. So what I ask my constituents is this: if you love the president, join him, be patriotic, and wear a mask. If you don't like the president, then just wear a mask to spite him. Same with me. If you think I'm doing a good job on COVID, or good job as governor, I ask you to wear a mask in public. Stay socially distanced, 6 feet apart. Don't gather in large groups. If you think I'm worthless and doing a horrible job, well, why don't you just prove me wrong? Wear a mask. Stay socially distanced. I believe that these little things will make a difference. Now, let's look back as to what got us here. There's no doubt that we as a state did incredible work in March, in April, and May. And then a lot of things changed in the country. We were all talking about just about nothing but COVID in March, in April, and May. And then there became a lot of hot issues across the country. There became protests, and there became issues that were being discussed and debated here in our home state. And for weeks on end, no matter what anyone else said, the coronavirus, COVID-19, the China virus, whatever you want to call it, certainly wasn't ignored by those of us that were in the fight, but it certainly fell off the forefront of the conversation. People let down their guard. The virus started spreading. We now are probably on the second, if not the third, maybe even the fourth iteration of what happened in late May and early June. Because somebody gets it, maybe they went to a bar with a friend of theirs, gave it to their friend maybe then gave it to their neighbor, and their neighbor gave it to their grandmom. The total number of fatalities are rising. It's a lagging indicator. We've said it for weeks now. The number of fatalities are going to continue to go up because the number of cases are going up. So a lot of good people have struggled with this virus. A lot of good people in our state are currently struggling. And so to those of you who simply want to make a political statement, what I say to you is this: let's all come together as a state. Let's come together as a people. Let's recognize that what has happened in the past is in the past. We can't change what we did 2 weeks ago. We can change what we do tomorrow. We can make a decision today to do better tomorrow. And my ask of each of you is to join me in doing better tomorrow. Let's wear a mask. Let's stay socially distanced. Let's not gather in large groups. Let's be smart. And most of all, let's stay safe. Dr. Dobbs?
Thank you, Governor. As you mentioned, we've got over 1,500 cases to report today, 1,547. And of that number, we're also reporting 34 deaths. So far, we've lost 1,423 Mississippians from coronavirus, a staggering number. If we want to look at the death by ages and also the cases by ages, of course, we know that it's more impactful in the older age groups, but it also hits younger folks too. If we look at cases, we know that the 18 to 29-year-old age group is the area where we see the majority of cases at 10,126. But even younger folks are getting the virus that we know of. We have 2,413 cases between the ages of 11 and 17. We have 990 between the ages of 6 and 10. We have 850 between the ages of 1 and 5. And we have 356 confirmed cases in children less than 1 year of age. So children do get it, but fortunately, mostly they don't get as ill. But they can get ill, and even when we checked this morning, there were 2 pediatric patients in intensive care from coronavirus in the state of Mississippi. So severe disease does happen. And unfortunately, even for the younger age group, we do see deaths. There have been 10 deaths from coronavirus in individuals between the ages of 18 and 29. And then just yesterday, we recorded the death of a 20-year-old from coronavirus in the state of Mississippi. We're going to try to get some more details on the deaths in the younger folks so that people can have a better appreciation that there really is risk out there regardless of your age group. If we look at hospital numbers, we're continuing to see increasing hospitalizations. Again, not a big surprise. We know that hospitalizations and deaths both lag case counts, so we'll continue to see increases most likely. Excuse me. That was water in my throat, I assure you. We also are seeing significant ICU capacity strains. We have 293 COVID patients in our intensive care. 40% of all intensive care patients are coronavirus. That's absolutely astounding. Just a week or so ago, it was 30%. I don't know how far we can go until we're absolutely going to be outside of standards of care and going into crisis care because we just can't take care of the burden. And the last thing I just want to say is for reporting, I just want to remind our clinics and physicians, nurse practitioners, that if you do rapid testing for coronavirus and you get a case, you absolutely have to report it to the Department of Health. We know that there are many cases that we're missing because they're not getting reported. The reference labs have to report to us also. But if you're a physician or a clinic and you're doing rapid testing and you find a case, you must report it to us by law. Additionally, we strongly implore you to enter it through the electronic web portal with the patient information at the Department of Health so that we can rapidly add that to the case count and make sure that we have those bits of information that will help us share with you and the public. And then the last thing I'll just say is, you know, the crowd situation's killing us. People are absolutely not staying in small groups. I know you guys see social media, and I see as little as I can, but what little I see people in massive groups. There are rules about what kind of groups can get together, and they're not being followed. These are areas where we're going to have these super spreader events, and people are going to get sick, and people are going to have hospitalizations and deaths around them. We do not need to be having mass gatherings. I don't care if it's, you know, social or whatever purpose. When we put a lot of people together in a large group, that is extremely dangerous, indoors and outdoors. So please refrain, and please keep your kids from going too, because they're going to get it and they're going to bring it back and spread it to the family, and they may get sick as well. That's all I have, Governor. Thank you.